It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
So here's the story, my friends. You're at home, you're doing something, and all of a sudden you feel something funny in your chest, okay? And maybe something in your arm, and you're not feeling the way you should be feeling. But then if you're like me, the biggest baby that walks the face of the earth, it'll go away. It'll go away because I'm not going to call a doctor and say I got some pains in my chest, etc. But then a little bit later on, it's happening again, all right? And now you're really concerned, but you still don't want to call the emergency room or talk to any doctor because, God forbid, they should find something. Well, let me tell you, that's me. However, thank God I'm married to a registered nurse. And soon as something happens, you got to respond. And that's what we're going to talk about today, chest pain, and what you should do. And we got two of the best that you could imagine in the health field, Dr. Yaqoob Mohyuddin and Orlando Rivera from the Lehigh Valley Hospital Network. Great opportunity. So, Dr. Mohyuddin, before I get into my moaning and groaning about why I'm the biggest baby in the face of the world, the earth, tell me a little bit about yourself.
Well, thanks for having us on, Sam. I'm a cardiologist in Hazleton. I've been here for 11 years, and our Lehigh Valley Physician Group practice is across from Walmart at the Health and Wellness Center. All of the cardiologists are there in one location. And I'm also the Associate Chief of the Division of Cardiology.
And Orlando, a little bit about yourself?
Sure. My name is Orlando Rivera. I'm a doctorally prepared registered nurse. I have been with Lehigh Valley Health Network for about 15 years, and I currently hold the position of Director for Quality for the Lehigh Valley Heart Institute at Lehigh Valley Health Network.
And you're doing a great job. You're doing a great job.
I'd like to think so.
Yeah. What is the Lehigh Valley Heart Institute?
Lehigh Valley Heart Institute is made up of cardiologists, cardiac surgeons, and it's bringing all of cardiac care for the patients in the region under one umbrella. And it includes our satellite hospitals, Hazleton, Pocono, Pottsville, and it really allows us to be able to provide a more comprehensive care and a more collegiate team-based approach.
Is that how it works in Orlando?
Absolutely, and I'd like to add, thank you, Dr. Mohyuddin. There's three basic elements to a Heart Institute: research, provider education, and patient care. Those three things combined allow us to provide the highest possible quality care to the patients that are in our communities.
All right, so I just did a scenario, okay, and believe me, I'd be the person who it'll go away, okay. Yeah, and because I'm not, God forbid I should call, but however, that's not the way it should be, right? So tell me about chest pain in general.
So you're absolutely right. Chest pain is one of the most common reasons why people seek to go to the emergency room. Nationwide, approximately 5 million people each year will go to the emergency room because of chest pain. Majority of these reasons do not end up being cardiac in etiology, but the downside is that you want to be able to get the care for chest pain in a expedited, rapid fashion. So some of the symptoms that people can have, chest pain can be burning, tightness, heaviness in the chest. It can radiate to the neck, back, or jaw. It can also be associated with shortness of breath or sweating episodes. So if any of those symptoms happen, the best thing to do is to call 911 and have them evaluate you, take you to the emergency room. It's recommended not to go yourself because in case it's a heart attack, people are more prone to having sudden arrhythmias and sudden death in the setting of a heart attack. So let's say you're taking yourself to the hospital, you don't have the capability that the EMS or the ambulance has in order to be able to provide the rapid care that you need, which can include defibrillation, shocking the heart. God forbid if there's an incidence where the heart rhythm is irregular and dangerous. They have the capability of doing an EKG right there, transmitting it to the appropriate emergency room or the cath lab where they need to be able to see it and to figure out what's the right approach for this patient.
All right, so talk me through the fact that, first of all, when you start getting these uncomfortable things, your blood pressure starts, you start thinking about a lot of things, and you're nervous, and you don't know what's happening. Am I going to die? Am I having a heart attack? And maybe it'll go away. I'll take an aspirin. I'll rest. I'll lay down, et cetera, et cetera. What do you say to people like that?
So, those are all, okay, it could be this, it could be that,
yeah.
But we don't want to take a chance with this. With chest pain, there are three major things from a cardiovascular perspective that can be extremely dangerous. One is a heart attack. The other one is blood clot in the lungs that can be dangerous and deadly. And the third is a tear or dissection of the aorta, the main blood vessel that's carrying the blood out of the heart. And all three of those can be extremely dangerous. And you want to be able to have that checked out and not assume, it's just muscle ache or muscle pain, it's just heartburn. Although those symptoms are similar because it's the same nerve that carries those signal to the brain that causes us to have the pain sensation, but the etiology can be varying and dangerous.
Okay, so I'm experiencing that, and I said I'm blessed because I have my wife who's like on top of me all the time, so a person could be home by themselves, experience these. You recommend that they, don't chance it, dial 911. So what happens then after you call 911?
So 911 is called, the EMS is dispatched, they come to your house or wherever you are, right. And the first thing they'll do is they'll take a look at you, they'll check your blood pressure, get an EKG. An EKG for a heart attack is extremely, extremely helpful. It kind of helps the EMS know, okay, is this person actively having a heart attack, or is this something that's a little less intense? And also, pain can come and go. So just because you're not having pain, it's, usually the heart attack pain will come on for 15-20 minutes, go away, come on with exertion, go away. So they also have the ability of repeating the EKG if need be.
So at that particular time, is there anything administered?
Yes. So if they deem that it's pain related to a heart, they can give sublingual nitroglycerin, which can dilate the blood vessels,
okay,
and relieve some of those symptoms. They also give aspirin right away to people to be able to help with preventing thrombus or a blood clot that usually causes a heart attack.
So keeping in mind, in Orlando, keeping in mind when that EMS comes, okay, the people in that EMS van or truck or whatever it is are trained people. They're not taking someone off the street, going down and pick Sam Lesante up, he's getting pains in the chest.
Absolutely, absolutely. They're highly trained professionals. In the old days, we all associate the ambulance with a van where you just dump somebody in the back and just drive real fast. Nowadays, they're highly trained paramedics, emergency medical technicians, and even nurses that work in the pre-hospital arena. So they're trained in trauma, cardiology, neurology. They're generalists. But they're really good at heart care. So like Dr. Mohyuddin said, a 12-lead EKG will reveal a heart attack, but it doesn't stop there. In addition to their treatment, there's communication that happens with Hazleton, and sometimes that communication then extends to a PCI center. That is where the cardiac cath lab is, where you ultimately go to get that heart attack dealt with. And so that's where you see collaboration with air ambulances like medevac. So ground ambulance will get to the house, grab the patient, find that, oh my God, there is a heart attack going on. They call the hospital coordinates that air medical ambulance to come in. The patient is handed over to medevac, where you have flight nurses and paramedics continue treatment all the way to the cath lab, where they go in and ultimately fix the problem.
So, and that's what I want the viewers to understand. There's total care from the moment that the EMS people get there, okay? So they're in, like, do you get involved or any cardio, or like Chotlo or you? Or
So with the EMS, the emergency room physician is involved with communicating with the EMS and directing them how to provide and what care to provide for that, because they're the trained folks for that particular time.
Okay, so then at that particular point in time, correct me if I'm wrong, they're right there knowing exactly, well, almost what is happening. So when they're talking to the emergency room, they're telling them, okay, this looks like, et cetera, and they have the test, and I'm sure they know what's going on. So they determine whether it comes right to medevac, or if they come into the emergency room, where they're going to go. If they stay in the emergency room, that means what test do they then go through?
So if a person is not actively having a heart attack, but they're having chest pain, and so there are two main types of heart attacks. One is a heart attack where there's a complete occlusion of the blood vessel providing blood to a particular part of the heart, which is called the ST elevation MI or STEMI. That needs to be taken care of right away. It needs to go to a cath lab to get a coronary angiogram and open up the vessel. So when the EMS does the EKG, they see the signs on the EKG which suggest if it's an ST elevation MI. If that's the case, the ER physician is involved. They will go to the ER, go to the medevac, the fastest route to the cath lab. And when they go to the catheterization lab, the interventionalist will go through the groin or the wrist, inject the catheter up there, inject dye, and find out where the blockage is and put a stent and open up that blood vessel.
So there's a process that goes on, which is from the moment the person they're there, you know, there's care being, you know, and there's people being involved, finding out and seeing what's happening with the.
It's part of our chest pain center. Everybody from the EMS all the way to the interventional cardiologist, everybody is on the team, and we're in constant communication to know what that patient needs right there and right then.
The process begins with provider education, the paramedics and nurses, and making sure that people like Dr. Mohyuddin and others educate them on signs and symptoms of a heart attack, how to read EKGs correctly. We have fail-safes, so in addition to education, ambulances are able to transmit those EKGs to the ER so that the physician can see on a monitor what it looks like before the patient even arrives, almost like a second opinion if there's any question.
Okay, so let's assume you're Sam Lesante, the biggest baby walked on the face of the earth when it comes to medicine. And you decide that it'll go away, okay? And then maybe a couple hours later or a day later, okay, you're experiencing the same thing or maybe a little bit worse, okay? What are the chances here that, you know, you should have done something? Because it's always like, oh my God, this is unbearable, I have to do something, okay? It's best that if you get those uncomfortable feelings, dial 911 immediately so they could see if it is something major. Am I correct in saying that?
Yes, so if you're having symptoms, you want to go to the emergency room, dial 911, be taken to the emergency room, and if it's not a heart attack right there and then a separate process is involved where we, everybody who comes in gets an EKG, gets blood work. Blood work will show us if there's a damage to the heart muscle or not. If there's no damage to the heart muscle, then we look at what your risk factors are. If there's a patient who's got risk factors such as diabetes, high blood pressure, prior history of a heart attack, history of congestive heart failure, family history of premature heart disease, or history of smoking, then those people are higher risk. So then we do further testing, further investigation to find out, okay, is there an underlying blockage that caused this patient's symptom? And the whole process, sometimes it involves people coming into the hospital and staying overnight to be ruled out for a heart attack. Yes. And at times it involves other tests such as a CAT scan to make sure there's no blood clot in the pulmonary arteries or the lungs, which can be dangerous and deadly. Sometimes people have chest pain, which is not a heart attack, it's a tear in the aorta, and that can be seen by a CAT scan and needs to have, depending on where and exactly, needs to have urgent heart surgery.
So I wanted to add to that, and this is more for the audience because it's a very important point that you just started to make. So this is not easy, right? So the symptoms, especially with women, tend to be different. So we talk about chest pain and discomfort with women. It could be jaw pain, back pain, what we call atypical symptoms. It could be anything, right? It could be you had bad food yesterday. It could be nothing. I can tell you from years of experience, I used to be a flight nurse with our medevac, and one of the number one things we see when it's too late, right? It's a cardiac arrest and we get there, and now we went from somebody having a heart attack that devolved into a cardiac arrest. We hear it all the time. history of discomfort. We didn't think it was anything. We thought it was, I have pain all the time. And then they waited or they didn't take action. And I know it's difficult to pick up and dial 911 because you feel like, what if it's nothing? My neighbors will see the ambulance come in. We have to get away from that mentality because this is when bad things happen. And it can happen to anybody. It can happen to a seemingly healthy young adult that may have undiagnosed heart conditions. So, and we do it too. Healthcare providers, we're the worst patients in the world sometimes because we think we know what's going on and it's like, well, it's not quite pressure and I'm moving my arm and nothing's happening, right? So that's something that we want to make sure we drive the point home that if it's a symptom that is not normal for you and there's no easy way to explain why you're having this discomfort or pain, that's the time you should be dialing 911. If it's nothing, we don't get mad. We get there, okay, it's nothing. They don't get upset if it's nothing. We'd rather be nothing than go in when it's too late.
You'd rather be safe than sorry.
Yeah, and that's the key. There's because again, you brought great points up, and you maybe it's nothing. I've had this before. When you hear stories about, my husband went out, he was doing something, he dropped dead. Okay, he had a massive or a sudden heart attack and dropped dead. I'm just wondering if these cases, if there was symptoms before that happened that could have prevented that person from dropping dead. You know what I'm trying to say, Doc?
Yeah, so there are times when people have previous symptoms. They may not be typical symptoms of burning or tightness or heaviness, and they may misinterpret these symptoms. But it's also not uncommon to have a sudden death from a heart attack. And that happens when there's an occlusion of a blood vessel and then the heart fibrillates. So if there's not a defibrillator or available equipment to get the person back, then it's a dangerous consequence.
What does it mean when someone says it was a widowmaker?
A widowmaker is a blockage in the front artery of the heart called the LAD, or the left anterior descending. It's one of the major arteries in the heart, one of the larger arteries in the heart that provides blood supply to most of the heart muscle. That's why it's called the widowmaker.
But people don't even know they have it, right?
Yeah, they may not. So the only way to know if someone has a widowmaker or not is by having a coronary angiography or a CT angiography and seeing if there's a major blockage there or not.
Okay. Folks, I'm talking to Dr. Mohyuddin and also Orlando Rivera. I'm telling you folks, I'm that person, when something happens, it'll go away. Don't do that. Don't do that. Just dial 911. A lot of great information here today. We come back, we'll talk about certification. Now, there's the important thing. I mentioned that when someone comes to you, you want to make sure they know what the heck they're doing. We come back, we'll talk a little bit more about accreditation, how they got accredited, and how lucky we are. How lucky we are to have the Lehigh Valley Health Network here and great people like it. There's many people that come on my show. We've saved many lives from this show. And I'm hoping that this show is going to at least help you out and give you information that's so important. They're nice people and they'll take good care of you. We'll be back right after this message. Welcome back to the Sam Lesante Show, folks. Remember, 24/7 SSPTV.com. You can watch all of our neighborhood shows. Pottsville, Comcast 190, 7 to 11 p.m. every day. Wilkes-Barre Mountaintop, that area, Saturdays and Sunday evenings, 7 to 11 p.m. at Channel 92. And, of course, Lackawanna County, Channel 190, Comcast 8 to 11 every Saturday and Sunday morning. My guest today, Dr. Yaqoob Mohyuddin, no stranger to the greater Hazleton area, and Orlando Rivera, who is the Director of Quality. They do a great job. Let me get to you, Orlando. We talk about accreditation. Let's talk about chest pain accreditation, why it's so important.
Absolutely. So recently we achieved chest pain accreditation for Lehigh Valley Hazleton as well as Lehigh Valley Schuylkill site. The reason it's important is because accreditation allows us to maintain the high quality standards in the world of cardiology. But it goes beyond that. American College of Cardiology, the leading expert, agency on anything related cardiac, working with the American Heart Association, with the guidelines, allow us to break silos. So in the past, a lot of our care was focused on what happens in the hospital. Accreditation expands that. So there's a component of pre-hospital or EMS education, community education, industry. We're talking about education not just for nurses and physicians in the hospital, but also community members. So education is a big component. But it also allows us to look at our care within the hospital and making sure that it's standard across any hospital, so that if you walk into Hazleton, it's the same high quality care that you would get at Schuylkill, and it's the same care you would get at any of our sites. Think of a franchise, right? You know, you want a burger, you may not be the best example, but it's the same anywhere you go. In addition to all of that, it allows for people that typically would not work together or communicate to now work as a single unit. Community, EMS, industry, even administration, and the ways we look at certain, you know, quality metrics and processes, all of that is within the realm of a chest pain accreditation.
What's MI Alert? What's the MI Alert program?
So the MI Alert program is a process of care. We spoke briefly about it. It's when you're having a heart attack. The reason people know what to do, what button to press, what phone call to make is because we have a program, right? So the program means if you're having a heart attack, the paramedic knows who to call, what EKG to send. The ED physician will know who to call to arrange for the helicopter to come in. The helicopter will know once they're called, it's because an EKG showed a heart attack, so they have the same protocols, the same treatments. Dr. Mohyuddin will know, okay, that patient that went over to Lehigh Valley Hospital, Cedar Crest to get that stent placed, eventually will come back and then he'll pick up the care of that patient. So it's a process of care where everything we do is prescribed, it's rehearsed, and everything we do is measured. And all those metrics, you know, door to balloon time you hear often, which is from the time the patient arrives to the emergency room until that artery is open. We measure it in minutes because every minute counts. We look at door to EKG. If you walk in the ER and you're having a heart attack, we look at how long did it take to get that EKG. So it's a process of care for heart attack patients. People don't realize how much work and coordination it takes to save a life.
Yeah.
Because we're talking about minutes here. How long can you hold your breath? That's exactly what's going on in your heart when you have a blockage. Every second counts.
Wow. So. Doctor, primary stroke center certification, do strokes usually, if there's something going on with the heart, are they related to some area?
So in some instances, there is a relationship between strokes and a heart attack. If you look at, in general, vascular disease is about whether it's in the heart or the arteries in the neck or the leg, it's similar process. So majority of the strokes are what's called ischemic strokes, where a piece of plaque from the neck or the aorta breaks off and goes to the brain and causes an occlusion. It's the same thing, it's a heart attack, but it's in the brain, so it's called a brain attack or a stroke. There's also an association between irregular heartbeat called atrial fibrillation, where the top chamber of the heart is quivering, and that can cause clots to form inside the heart, which can then get dislodged and go to the brain and cause a stroke.
And I see here, you received certification in 2008 for the first hospital in EPA to receive the primary stroke certification. So you're really up on that one.
Yes, so we are a stroke certified center. We have been for a number of years. We have a teleneurologist that's available at Cedar Crest that is available to take care and guide the care of these patients along with the emergency room physician and figure out, depending on what the symptoms and what the presentation is of the patient, to see if they need clot busters to be able to get blood flow circulating to the brain, or if they need to be going down to have retrieval of the clot done from the brain for stroke patients.
Orlando, Trauma Center. You received a level 4 trauma center in November of 2015. Excuse me, what does that mean?
So much like accreditation, it guarantees the availability or the accessibility of certain resources on site at all times to manage trauma patients. So they can come into Hazleton, get a quick initial evaluation, and if deemed severe enough, then they can be flown to a level 1 trauma center where surgeons and other resources are available. So oftentimes we look at fairly minor accidents or things that may be questionable, and how do we enhance the care we provide to that patient. minimizing wasted resources, surgeons and the like. So what this allows us to do is to be able to accept certain sets of trauma patients to make sure that the evaluation is done before other decisions are made.
I'm looking at all these things, American Heart Association, stroke, all the awards that we got. Tammy, that's on the website. Everything's on the website. So it's very interesting, folks, to see just exactly how advanced and all the accreditations and awards that Lehigh Valley Hospital Network has received. All right, I just think it's important, you know, so you want to research, like, you know, when we talked that, well, who's your doctor? Dr. Mohyuddin, Dr. Child, oh, they're good because of the reputation they had. How do we keep ourselves healthy? How do we keep our heart healthy? What do we do? Because we're talking now when something happens. Let's talk about prevention, you know, as a heart specialist. What do you recommend people doing?
So the most important thing is really making sure, if you're smoking, to quit smoking. That's the biggest risk factor. Making sure your cholesterol is under well controlled, your blood pressure is under well controlled, less than 130/80. I tell patients who are over the age of 40 that they should all have a blood pressure machine at home and constantly or regularly monitor their blood pressure to see that it's not rising, because for every 10-point increase, there's a spike in the incidence of heart disease and stroke. And cholesterol, as I mentioned, having that checked once a year. And then what they do is they take the numbers, they take your risk factors, your age, your gender, and they plug it into a formula and then come up with a number and see if you need a cholesterol medication or not.
Okay.
Regular exercise, 30 minutes a day, 5 days a week. Watching your diet, a heart healthy diet, meaning healthy fats, nuts, fatty fish, salmon, and if you're going to eat grains, you should be in their most natural form, staying away from enriched flour, and using more whole grains, nuts, plant-based diet.
Well, interesting. Physical checkup, folks, at least minimum once a year. When you think you got to get to the doctor once a year.
Yes, absolutely.
Orlando, it was nice meeting you.
Same here.
Doctor, nice seeing you.
Thank you.
Keep the good work up there. You guys really, and women do a great job, really. And sometimes it's thankless, but you don't look for the thank you. You just want to keep people healthy,
Absolutely.
Right?
Thank you.
Remember, folks, if you need them, phone number is always available. 911 is the number to keep in mind. It's an easy number. Don't be like me. If you get a symptom, call. We'll see you next time.